Hey there, and welcome to another Health Essentials podcast. I'm John Horton, your host. If you've ever struggled with the allergy trifecta of itchy eyes, sneezing, and that dreaded runny nose, you're not alone. Allergies affect millions of people every year, which explains why there's no shortage of over-the-counter medications promising relief. The question, though, is which medication might work best to address your symptoms. We're going to break that down today with the help of allergist Dylan Timberlake. He is one of the many experts at Cleveland Clinic who pop into our weekly podcast to break down healthcare options. So let's try to make sense of all those allergy meds at the pharmacy and figure out which one belongs in your cart. Welcome back to the podcast, Dr. Timberlake. It's great to see you again.
Thanks, John. It's good to be back.
So I caught this interview with you where you talked about seeing patients who have spent years dealing with uncomfortable allergy symptoms without knowing that they've got all these great options out there. Are there really that many people who just try to soldier through all these issues?
Definitely. So I have a lot of people who come and see me and, they've tried Benadryl, right? They're like, I take Benadryl when it's really bad, but I just, I suffer through most of the time. And so that's a great patient for me because I'm like, here's our whole world of things we have. And so there's lots of options out there.
All right. Well, we're going to spend this show kind of talking about some of those options and maybe, what people can do. Let's just kind of start, though, with some basics. And sometimes, it's just hard to believe that being around a cat or spring blooms can just make you so miserable. What's happening in our bodies to bring on these allergic responses?
Yeah, it's a great question. So kind of as brief as we can, the allergy part of your body is part of your immune system. So most of us know that you make something called antibodies to help us to fight off infections normally. So that allergy part of your body is actually has specific allergy antibodies as part of its immune system effects. So if you're allergic to something, what has happened is your body has made one of these allergy antibodies to something that it's not supposed to, like a tree pollen or cat dander. And then that allergen now is what's activating the rest of that allergy part of your immune system. You release all these chemicals. People have heard of histamine, which it causes swelling and itchiness. So stuffy nose, runny nose, sneezing, itchy, watery eyes. Yeah.
So it sounds like basically your body just kind of takes this, pollen or like you said, pet dander or something like that, and kind of classifies it as a threat to the system and kind of sends out an alert and all this internal mayhem then kind of follows.
Absolutely. So at its core, your body is recognizing something that should be a benign stimulus and then reacting to it.
Yeah, we've all had that where you're like, why is this bugging me? And it's like, it sounds like your body just kind of goes a little haywire and classifies something as a threat when it shouldn't.
Absolutely.
All right. So when we've had this, and we've all dealt with it, I think, because allergies are so common. And eventually, I think we all end up going to the pharmacy because we know they've got a bunch of stuff there that might help us. What kind of options should we look at as kind of like a first line of defense? You mentioned like histamines. So that obviously antihistamines are kind of what helps with that. What are they doing? How are they going to help?
Yeah, you got it. So you walk into the pharmacy, you walk into the allergy section, and you're going to see a couple different things. So you're going to see your allergy pills, which are almost all over the counter, going to be antihistamine pills. That's things like Zyrtec, Claritin, Allegra, Benadryl, which I know you and I have talked off camera about Benadryl. We'll get to that at some point, but those are your antihistamines. Then you have nasal sprays, and there's a couple options for those. You have nasal steroid sprays. Most commonly people have used or tried Flonase, but there's a lot of over-the-counter ones, Rhinocort, Nasacort. And then couple years ago, now there is a nasal antihistamine that is also now over the counter called Astapro.
So much stuff. And this is why it's so confusing when you go to the pharmacy, because you're like, where do I even get started?
Right. Yeah.
Now, is there a difference between the various antihistamines? I mean, does it really matter if you're on, Team Allegra or Team Claritin or Team Zyrtec? Are they going to work differently?
Yeah, you got it. So if you look at, Benadryl is one of our older antihistamines, so we call it a first generation. all of these other ones that you and I are talking about, Zyrtec, Claritin, Allegra, I normally don't think about Xyzal, but Xyzal's in there too over the counter. They are all, we call them second generations because they're newer antihistamines. So big first branches, if you're going and you're looking for an antihistamine, typically I'm going to avoid the first generation. The second generation are going to get you all of the same benefits with less of the side effects that go along with it. To get back to your question then of like, are they all equal? If you look at them in studies, the answer is yes. I'll tell you, seeing enough patients, people respond differently to different medicines. So I have some people who see me and they've tried, all 3-4 of them, and they're like, Claritin's the one that works for me. Same thing, Zyrtec's the one that works, Allegra. So if you're using one, you don't feel like it's overly working well for you, switching to a different one is definitely reasonable.
Do people just go back and forth between some of them? Because I don't know if your body gets used to one and then all of a sudden it doesn't work as well. But if you throw another one in, all of a sudden you get better results.
Yeah, I'll say that I have a lot of patients who do that. Once again, it's this hard part of medicine of real world versus what the studies show. And then also, are there really negatives to doing it, right? And so if you look at studies, typically we're not seeing a lot of tolerance developing to these antihistamines. But I have plenty of patients who feel like one seems to stop working over time. They switch to another one, it seems to work. There really is no harm to doing it. And so if you're, for whatever reason, you feel like that is working better for you, great, let's do it.
Sometimes I wonder with that if it's a little bit of the power of the mind. If you think it's going to work a little bit better, sometimes you just feel a little bit better.
Very, very well could.
Now, you had mentioned Benadryl, which it sounds like is kind of the, like you said, the original one, the OG of antihistamines for over the counter. Is it that these other ones are just kind of a little bit new and improved, pack a little more punch? Or have there actually been like some issues with Benadryl or just some like concerns that have kind of come up over time?
Yeah. So both. If you look at efficacy, I will say I have some people who see me and they swear that Benadryl works better. It may. What may also end up happening is you may be getting some of the side effects from Benadryl that are helping with allergies. And so Benadryl can dry you out as well from like a negative standpoint. And then as you can imagine, if you're runny nose, that can dry you out from that. But really more of our worry with Benadryl is the side effects with it. And so with Benadryl, there's two big things. And so one of them is there was a study that came out that looked at chronic usage of Benadryl. And what we ended up seeing was increased risks for dementia with that. It's a big point to note. We don't see that with the newer antihistamine. So I have a lot of people who see me and they're concerned. They're like, I've been taking Allegra for 5 or 10 years. Is this going to happen to me? And we're not worried about that. But the other really quick, interesting thing with Benadryl is there was a study that looked at the sedation effects of Benadryl. And so we all know some people, they take Benadryl, they feel like they get knocked out.
It always used to make the kids sleepy. I remember we used to give it to them when they were at allergies or whatever else. And it did. It kind of would.
You got it, right? But there's an interesting cohort of people also who they take Benadryl and they're like, I feel fine. It doesn't affect me. But there was a really, really interesting study that looked at giving patients Benadryl and then putting them in a driving simulator. And even those who didn't feel like they were having any of that like sedation or any effect were operating at a similar level of sedation or intoxication as someone who's above the legal limit for alcohol, driving intoxicated that way.
Wow. That is just not something, you get pulled driving under a DUI for Benadryl just seems a little, a little extreme, but.
You got it, right? So we have, when we didn't have as good of alternatives, great, you're right. But in this day and age where we have as or better alternatives, we're going to lean on those.
Are these like safe to just take over and over and over again? I know a lot of people are on like a regimen where you'll pop a Claritin every day. Other people might just do it during certain times of year, or if you feel a little cruddy. I know I'll pop a Claritin every once in a while. I feel like my eyes get itchy or whatever. I swear it's like when my dog needs a bath or something like that. I'll take one and it instantly goes away. Yep. Is that safe to do in any of those options I threw out there?
Yeah, no, the new ones are safe. You can essentially take them as long as you need to. And I don't worry about long-term issues or side effects with them, especially if you're using them at kind of the over-the-counter recommended dosing of just like the one pill once a day for most of these. And then they work as needed. So that's the other nice part too, is most of them kick in fairly quick. Out of those second generation that we talked about, Zyrtec does kick in a little bit quicker than the other ones. So if you're someone who gets hives with some of these exposures and you want something to kick in pretty much immediately. Zyrtec's probably your best friend there. But out of all of them, they all work pretty quick. They all are fairly long acting. So if you're someone who needs something as needed, also any of those are reasonable to use as needed.
I got to say, I've toggled back and forth between Claritin and Zyrtec. I don't think I've ever used Allegra, so maybe I need to give it a shot at some point. But I don't know. I also just stopped the sales. So
I will say too, when we're talking about the little differences now at this point, Zyrtec is considered a less sedating antihistamine, whereas the other ones are non-sedating. So there is a small percentage of the population that'll still notice a little bit of sedation with Zyrtec, but it's a fairly small percentage. So I honestly, it doesn't bother me. I just tell people, if we're going to use Zyrtec, if you notice it's making you sleepier at all, go ahead and stop that and switch to Claritin or Allegra.
Yeah, I gotta say, I've never felt that, but I also drink a lot of coffee during the day, so I don't know what it would take to kind of knock me out.
Coffee's trumping your Zyrtec. No, honestly, the large majority, I said it's a minority of the population who will have that, so I don't worry about it. I use a lot of Zyrtec in my practice. I use all of them, but I end up using a lot of Zyrtec in my practice. It ends up being a little bit cheaper when you're buying it over the counter than Allegra. I will say anecdotally, a lot of my patients find Zyrtec and Allegra work a little bit better than Claritin. So I land on Zyrtec a lot of time as kind of my first line. But this is to say all of them are fine. Try whatever seems to work best for you.
So we've kind of hit the antihistamines, and those are, those little pills that will kind of stop that allergic reaction and that whole histamine response and all of that. Now let's kind of talk about nasal sprays and how do those fit into the picture?
Yeah, great. So there's two different nasal sprays. And I'll say most people, if they're going into the pharmacy and they're going to grab an allergy med, most are grabbing a pill. Our guidelines actually have been updated as allergists, where the pills, like if you see me as an allergist, our pills are no longer recommended as our first line in therapy. And it's just because the nose sprays, they're going to be more effective with essentially no significant side effects that go along with them. So if I have someone who comes in, they're like, what's the first line? It's always going to point people to your nose sprays.
Okay. Wow. That I think most people usually go right to those little pills. So why are the sprays then now the first line?
So they are really, they're more effective. And honestly, it's because they are right there where you're having the problem. And interestingly, the nose sprays, with your eyes and nose being so interconnected, the nose sprays can even help with some of those eye symptoms. So if you're looking at it, there's two different types of nasal sprays. So we mentioned already nasal steroids, Flonase, Nasacort, Rhinocort, and then there's another one, an antihistamine called Astepro. The biggest differences there for you is those nasal steroids take a little bit of time to build up in those tissues in your nose. And so you're going to get kind of more slower onset benefit days to weeks before you're hitting your maximum peak benefit. Whereas this Astepro, which is the antihistamine, you use it similar to the pills, pretty immediately you're going to notice the relief with it.
Okay. Wow. I did not know that was available. I guess I've used Flonase and typically when you start getting I always think of it when you have a little infection or something like that. I've never really thought of it for allergy relief, but it sounds like it can be effective in that sort of usage.
Right. And this is once again that personalized part of medicine you and I have talked about. Is like, John, if you come and you see me and you're like, every so often my eyes are itchy with my pad, I'm not going to put you on Flonase because you need to use it every day to get that good benefit. But if you come and you see me and you're like, every single spring, March through, May time, I'm miserable, then we're going to talk about starting a nasal antihistamine like Flonase every single day, kind of leading in and then continuing that throughout the season. Because the nasal steroids are probably your most effective, but the downside being you need to use them every single day.
Yeah, it sounds like you should very much look at them as like a maintenance medication. It's just
absolutely absolutely.
Well, that makes a lot of sense. So if you have people that have allergies, and whether it sounds like these are environmental allergies we're talking about. So you said springtime stuff, pet dander, those indoor dust, all of those sort of things that trigger the runny noses and the itchy eyes. If you just get on a regimen of using, a little puff in each nostril once a day, you should be kind of good and keep those symptoms down.
Yeah. So I would say the majority of people, and this is partly skewed because, right, like I see the people who normally are doing this and they're not getting better. But if you look at the large majority of people with allergies, if they're doing, a nasal steroid throughout their bad time of year, potentially add on that nasal antihistamine or an antihistamine pill as needed, most people, that's going to be enough relief for them.
Now, how does that steroid work? Because it sounds like then that's not addressing the allergic response directly, but is it just kind of addressing the symptoms that we get from it?
Great question. So it is actually treating that allergic response. So the steroids are decreasing that inflammation that's in your nose. I want to take a pause here to mention too, because we keep talking about steroids, and I know steroids get a bad rap. And absolutely they should, right? Like if you were on a steroid pill for a long time, we're going to worry about that. These nasal steroids, almost all of that steroid stays locally in your nose. We don't see it getting into the bloodstream. We don't see full body side effects or concerns with steroids. And so really these nasal steroids, they are really, really safe to kind of stay on, for however long you need them.
They're not going to help you bench 500 pounds. It sounds like is what you're saying.
Absolutely not. And they're not going to cause any of the scary side effects that come with steroids. So truly, they're a really safe medicine. They work really well. So what they do is they decrease all that inflammation. We talked about allergies being part of your immune system, right? So they decrease all that, immune system inflammation. And so they really are they're getting as close to treating the core problem as you can without doing something like allergy shots, which is actually making you less allergic.
Yeah. It sounds like they'll make you feel better. And I guess that's the goal everybody kind of has with taking any sort of allergy med.
Yeah, and they should help with all of it, the stuffiness, the runniness, the sneezing, kind of all of those symptoms.
Now why might you choose the nasal antihistamine versus the steroid? Like what would kind of push you that way?
Predominantly, it's someone who needs something more as needed. So by and large, they feel like they're okay or they don't want to have to take something every single day. Then I'm going to push them towards that nasal antihistamine, the Astapro.
That makes sense. So that you get the immediate quick response and, until you get your dog in the bath and get rid of the allergens that are on them, it'll kind of help you out.
You got it. And these are safe to use together too. So a lot of time, like I'll have people who do, a nasal steroid and a nasal antihistamine together kind of at the same time. They actually, prescription drug, they make them where they put both in the same bottle. But by the time you're doing both of those, we may be talking about like, should you be, is it bad enough? Maybe should you be seeing someone and talking about it?
Yeah, I was going to ask that, whether or not you can combine kind of the antihistamine pills and nasal steroid spray. It sounds like you can, and it sounds like they're actually doing different things. So if you take the antihistamine, that's getting to the actual what's causing the issue, and then the steroid nasal spray is actually dealing with kind of what it caused.
Yep. So steroid decreasing all that inflammation. The antihistamine really, when that allergic reaction happens, you release the histamine chemical. It has to bind to a receptor. So essentially think of like a key going in a lock and unlocking it, right? Histamine is the key unlocking it. Your antihistamine goes and it covers up that lock so the key can no longer open it up and cause the symptoms with it.
And I'm assuming then you can take like the antihistamine and like a steroid nasal spray together. I'm assuming you can't take an antihistamine and that nasal antihistamine. That's too much.
So you can get some additive effect of it. Same thing. So my threshold normally is like, if you're doing one, maybe two of these over-the-counter meds and you're okay, you're probably okay doing it. Once you're starting to like, if you like are using 2 every single day, you're getting into like needing more than that, you should at least probably be seeing your primary care doc, if not one of us as an allergist.
Yeah, no, that makes sense. It sounds like with any of this stuff, it's probably good to talk with somebody just to get to the bottom of what's going on and whether you really need to be hitting that medicine as much as maybe you are.
Yeah, definitely. One thing I'm going to mention here, John, too, just because this is a question that I see a lot in my clinic, is people have tried this Astapro. One thing to know with Astapro, it has a very, very bitter, bad taste if it ends up in the back of your throat. And we see a lot of people coming in and talking about, all we end up needing to do is talk about how to use your nose spray. So if you're okay, I kind of want to put that out there, is that when you use these nose sprays, there's a couple things that can help so that you're not tasting it as much. And the big things that come with that is we tell people to tilt their head forward and look down. You will have some that ends up running out the front of your nose, and that's okay, because what it does is the medicine coats inside your nose, and it's the extra that runs out the front. So all that would have been going down the back of your throat. But the other big one that is notorious is, feels really natural to try to sniff your nose spray when you do it, right? So you spray and sniff at the same time. We don't want you doing that. You do that same thing, it's going to just suck all of it in the back of the throat and you're going to taste more of it. So if you do your nose sprays and you're having issues with them, to look down, tilt your head forward, and when you put the nose spray in, you squirt, just kind of keep breathing normal. Hopefully you're not going to taste it as much, and then you can tolerate these over-the-counter meds better.
See, this is why I love these discussions. This is where I find out what I've been doing wrong. Because I got to say, when I use the nasal sprays, I'm a big, like, you go in and you kind of you breathe up. I don't know. I always feel like that gets
And
it
a gentle breath in is fine. But I tell people, even though I notice, if I use my nasal spray, it feels like you go to spray and you're like, you're ready to go. And you're like, I'm going to sniff this in. You have to consciously be like, every time, okay, don't do that. It doesn't need to do that. Because, yeah, you're just going to swallow a lot of it. And everything that ends up back that you're swallowing is just extra stuff that.
Here I thought I was doing something right. I'll change it the next time.
I'm sure you do a lot right, John. I'm sure.
Trust me, the more I do this podcast, the more I realize I'm doing a lot of stuff wrong, but I'm getting better. That's the point of having these discussions.
I love it.
One more medication kind of throw in there, decongestants. Like, do those have any role when you're talking about allergies and kind of the stuff that follows?
Yeah, they do. And so the biggest decongestant most people know about is pseudoephedrine. And so something like a Zyrtec D has Zyrtec plus the Sudafed component. I am a fan of not really ever doing like a Zyrtec D or Allegra D. If you feel like you need a decongestant for some reason in addition, I try to keep them separate just so that like you can use your Zyrtec on the days where you need that, and then only using that additional decongestant on the days where you feel like you need it. The decongestants start to get a little bit more side effects, and I start to worry about it more with people who have high blood pressure, especially the pill decongestants. And so, to be honest, I try to stay away from those from our long-term use. Short-term usage, you have a bad allergy flare, you have allergies, and now you've had a viral infection to kind of get you through. I'm okay with that. To be honest, what I like more even than Sudafed or the orals is a nasal decongestant of some kind. So Afrin's the one that most people have heard of. Now, flip side, most people have heard of someone getting addicted to Afrin. And essentially what happens is if you use Afrin for too long, you can get a really bad rebound congestion. So essentially every time you're not using it, you get worse congestion than you had beforehand, and it can get pretty bad. So I just tell people, if you're going to use Afrin, no more than 3 to 5 days in a row. But to be honest, I love it for those bad periods where like you're someone who has allergies and you're okay most of the time, and like this is a really bad couple of days. Use it. It's only going to help for the stuffiness. It's not going to do much for the runny, sneezy side. But if you're really plugged up and you need something to get you through, it's kind of a great over-the-counter option.
So, and just to clarify too, because I threw it out there, like Claritin D, Zyrtec D, Allegra D, those are the antihistamines with a built-in decongestant. And it sounds like what you're saying is your recommendations are more, take your antihistamine, and if you need it at that moment, take a decongestant separate instead of trying to combine them for regular use.
You got it, because then you've separated it out so that if you don't feel like you need the decongestant, now you're not stuck just taking the antihistamine plus the decongestant. You can use that just when you need it.
Yeah, it sounds like, when you look at using decongestants, I take it you should probably just lean on those when you do have that extreme stuffiness and you're having trouble breathing and things like that. It's not something to lean on as more of a maintenance medicine.
Absolutely. I really much more short-term usage. And honestly, most of the time, by the time people see us, if they were to need a decongestant chronically, there's other things that we'll do, prescription wise or other treatments and therapies, just because I really, really try to keep people off of the decongestants as a long-term.
Yeah, no, and that makes some sort of sense. And I guess you don't always deal with that. So, and there's other ways to kind of tackle that problem, as we've kind of discussed here with the nasal steroid sprays and all of that.
Yep, you got it.
I want to go at it again just because it's such an important thing, and I know people always ask about it. But these products, from what we know, they are safe, and the side effects are it sounds like are really pretty minimal.
Yeah, you got it. I honestly, outside of Zyrtec making, a low percentage of people sleepy, I don't counsel much when I start these outside of saying these are safe. You've probably read scary things about antihistamines. That's with Benadryl. I worry about that. These newer ones, I don't worry about these things with. The nasal sprays, the medicine all stays local. So really you shouldn't have any significant, side effects that go along with those. Occasionally, some of the nasal steroids can dry you out in your nose a little bit. So occasionally we'll see some increased nosebleeds, but there's ways we can navigate that if we need to.
And I think the key is always you need to follow those guidelines, which I know nobody likes reading all that fine print that are on these bottles and the medications, but it is important to kind of make sure you don't overdo it on any of these medications.
Yeah, absolutely. And then the flip side of that is some of these medicines have certain labels like don't use for more than a month. And so people will come and see me and they're concerned. They're like, you're telling me to use my nasal steroid for, year round, but the bottle says only for a month. And part of that understanding is just for something to have an over-the-counter labeling, that is different than sometimes what our prescriptive labeling is. And essentially what the FDA is saying is, if you need this for that period of time, you probably should be seeing someone and talking to someone about it. So once again, if something is on the back of your bottle that's different than what your provider's talking about, for sure, ask about it. But there's probably reasoning why we feel okay using those for longer than it says to.
Yeah. If you're somebody who is taking, you've kind of self-prescribed, taking Claritin or Zyrtec or any of these medications, regularly, is there a point that you should get in then and see a doctor and just kind of figure out what's going on so you're not taking something unnecessarily?
In general, I'm a big proponent of having a primary care physician or provider, right? And so, seeing them for your other routine health maintenance needs. And so you should be seeing someone anyway, and then bringing these medication usages up to them. And then they can kind of help to kind of keep a good gauge on, is that okay or is it not okay? And so I guess your question specifically, if you're just taking it, do you need to see someone? Maybe not. But also I caution to say that because I very much believe preventive medicine is great. And so you should be seeing your primary care providers for other reasons and bringing these things up to them.
And it sounds like too, if you're taking them and maybe not getting, full results, I mean, you're still struggling a little bit, you're having some issues. It sounds like there are other options that you kind of have available to you, prescription options that may also help people and really get to the root of the problem.
Yeah, absolutely. And so once again, once you start to do a couple of these and it's not working, definitely see your primary care provider, or potentially come in and see one of us as an allergist, and we'll kind of help get to the root cause of it. This is not the point of this conversation, but there are things we can do to talk about, like if we know what you're allergic to, decreasing exposure to these things. And so while, a lot of us are like, well, I'm pollen allergic, how am I going to do that? There's things we can do for most of this, for pet dander, for dust mites, for pollen. And so, even if that only gets you 20% of the way better, now doing that plus, one of these medicines or two of these medicines, we might get you all the way there. And just knowing what you're allergic to might be half the battle.
Yeah. And everything fits together so much. And I know we've talked before about stress and sleep and all these things that are part of everyday life. And they can all have, weigh in on how your immune system's responding and what your reactions are. So sometimes you need to have a discussion with your doctor just to kind of get to the bottom of what might be causing your reactions.
Yeah, you got it. And then also potentially talking to your doctor and making sure that there's no other reason why you might have these outside of allergies, right?
Yeah. Well, we talked about that. There could be so many other things that cause, these issues that we just kind of tie to allergies, but sometimes you just got to get to the bottom of what's causing the problem.
Yeah, you got it.
All right. Well, Dr. Timberlake, this has been a great discussion. You definitely gave us a little more sense as to all those things that are in the allergy aisle at the pharmacy. We're going to leave people with kind of one thing that they should take away here. What would it be?
I would say you have a lot of great options over the counter. Typically, if you need something from a daily usage, I typically rely on our nasal steroids. If you need something more as needed, my preference is typically your nasal antihistamines. But there's all those different options out there. And those second generation, Zyrtec, Claritin, Allegra, Zysol, they're all really safe as well. And so just kind of find what works for you. And if you're having issues with that, see one of us, see your primary care provider, and we can try to help out with it.
All right. Well, that pretty much gives folks a shopping list if they want to go and take care of those problems.
Perfect.
Well, Dr. Timberlake, thank you again for coming in. You are always fabulous at dropping knowledge on us, and can't wait to have you back.
Thanks, Sean. It's been great.
Allergies can be super frustrating to deal with, but over-the-counter medications may be able to put relief within your grasp. Thanks to Dr. Timberlake, you've got a good idea on where to start to find that help. If you liked what you heard today, please hit the subscribe button and leave a comment to share your thoughts. Till next time, be well.